Hey everyone, good afternoon. This is Pat Ryan. Thank you for joining on this Tuesday afternoon. I hope you had a safe and healthy and small and a relaxing Thanksgiving. It's been a week since we had our last update, so... Hey everyone, good afternoon. Oh, excuse me. Got to turn off my own phone there. It's been a week since we last caught up, so a lot has happened, and so this will be a slightly, probably longer update, and then I would want to make time to answer a few questions as well. We're going to focus really on the immediate COVID situation. At the very high level, looking at the data and the numbers for the last week, it is not a pretty picture, and we'll talk through all the numbers, but I want to be crystal clear. This is me sounding the alarm bell that we are now definitively going to have a worse second wave than the first wave. Just looking at the numbers, we are already almost to those numbers, and that's before any of the impacts of Thanksgiving and so on, which we know we're concerned about. So it gives me no pleasure to say that, but I want to be clear always and really let the data and the health experts drive where we're at, and that is where we're at. So please help send that message and ring that alarm bell that things are heading in a very bad direction, but that does not mean that we are without hope or without the ability to change that, because we were at a similar point back in March and April. We made changes, we all worked together, and we got this back under control. So that's what we need to do again, and we'll talk about how we're going to do that in the second half here. But starting with the numbers and the data, I actually want to start with a graph that I shared several months ago, and I shared this from one of the leading public health think tanks in the country, and this was, at the time, we were on the downslope of our first wave, and we were feeling very good about the fact that we had made it through, but based on our health commissioner and other public health experts, warned that there was a likelihood that there might be a second wave and that it could even possibly be worse than the first. And I want to, again, use this to anchor us in the science and in really the advice we're hearing across the country and right here, that viruses do what viruses do, and the only way that we can impact that is by collectively coming together and taking these individual precautions with our families, with our friends, in our businesses, and our places of work. As much as we want to will this thing away and sort of get through it, we can't. We have to face it head on. We have to take these actions again, and then if we do that, which we know we can, then I think we can emerge out of this second wave. We can blunt the second wave, and we can get to a place where we have a vaccine that we can safely and effectively distribute. So where are we at in the county with cumulative numbers? Total cases since the beginning of the pandemic, just under 3,500, 3,495. We've now tested 155,000 plus residents. The vast majority, 2,412, have recovered. Unfortunately, since our last update and over the weekend, we did cross another grim milestone and surpass 100 fatalities. We've now had 101 fatalities of county residents. We're starting to see that number pick up a little bit, but more concerningly, we know that is a lagging indicator, and even hospitalizations are a lagging indicator. And with the case numbers we're seeing, we know that there will be more tragedy to come. So please think about all those who've lost someone in the last few days and weeks, and those who have loved ones in the hospital. We're thinking of you, and we're pulling for you and sending our love to you. In terms of our hospitalization numbers, this is one small glimmer of positive news in the numbers. Our hospitalization numbers are still relatively low. We have 8 total hospitalized, 2 in the ICU. That's actually down from what we were a week ago. Again, though, the thing that I want to caution here is we know from the first wave This starts with positive cases. Some number of them are hospitalized, and then some number of them, often after several weeks, ultimately succumb to the virus. So we know that we will likely see that those numbers going up. But again, if we can get the total caseload down, we can affect the hospitalizations and the fatalities. Active cases, this graph that we're going to put up here, this is really the one that just makes it very clear where we're at, and again emphasizes that we need to be ringing the alarm bell. You can see that we are now at 928 active cases, and when you compare that to our peak back in late April, you can see we're almost to the worst point that we were at the worst of our first wave. So to be exact, the highest number of active cases that we had in the county was back on April 26th. We had 1,006 active cases on April 26th. To be very close to that number at this point on December 1st, without seeing really any of the impacts of any get-togethers from Thanksgiving, is a very concerning place to be. And so that's why, again, we want to get the word out that we all need to take action here. Next slide is the new positive cases and the next indicator. This again gives cause for concern. Since it's been a week since our last update, I'm going to look back over the last week and give you a sense of the new infection rate. So in the last week, we have tested 7,261, and had 302 positives. That puts us over that week average at a 4.2% new infection rate. Again, if you remember, even just going back to October, we were under 2%, close to 1%. So quite rapidly, we are now at a 4.2% week average. The last 24 hours, it's down a little bit. We had 51 new positives out of 1,347 tested, 51 out of 1,347. That's 3.8% in the last 24 hours. I know that's a lot of immediate numbers, but I want to share a few more numbers with you just to give you a sense of the overall trajectory. If you go back, I can't believe it's December 1st, but it's December 1st. If you go back exactly a month to November 1st, we were at 257 active cases a month ago. Fast forward 2 weeks to November 15th, and we had increased 53%, and we were up to almost 400 active cases. Fast forward another 2 weeks to today, to December 1st, we're at 928 active cases. So in 2 weeks, we went up 137% in 2 weeks. So over the course of the last month, we have nearly quadrupled the number of active COVID cases. And an important caveat, that those are known COVID cases of those that have been tested. As we remember from the first wave, it's certain that there are more folks who are potentially asymptomatic or have mild symptoms and are positive and could be transmitting or could see the virus progress. So again, I share all those numbers not to necessarily cause us to put our head down, but actually to cause us to lift our head up and say, this needs to be a moment to rally collectively and get this back under control, but we need to take it seriously. The projections, you can see our projection graph here. The projections are dire, and you can see a steep incline in that total number of cumulative cases. And we're really trying to once again flatten that curve of the second wave and blunt the impacts of this second wave. Hospitalization numbers, we are, as I said, at 8 currently hospitalized with 2 ICU. More than sufficient need here. We did see yesterday Governor Cuomo and the health department put out a lot more guidance about hospital capacity, factoring in hospitalization numbers, bed availability numbers, and staffing numbers into some of the new metrics that the state will be using to designate the yellow, orange, and red zones. I think that was a smart and positive development that we're factoring in that that component. That's something we've consistently been looking at here in the county. So as we evaluate, as the state evaluates any changes to restrictions and so on, they will be factoring in the hospital numbers. Part of the reason for that is that in other parts of the state, we are seeing hospital capacity get very close to tested, in particular Western New York, Buffalo and Erie County and the surrounding counties in Western New York are starting to reach a similar point to what New York City was in the first wave. Buffalo over the last month has seen their cases have an increase by a multiple of 10. So that is the trajectory there, and part of the reason that statewide we're going to be now working even more closely with our hospitals and healthcare providers to make sure we have that adequate capacity. Beyond that, in terms of our overall COVID response, based on what we learned in the first wave, we are still very much executing our rapid response plan, which really has those 5 components. Key to that throughout is testing. We are still working to up our testing capacity. I know we're getting reports of longer lines at some of our testing sites as more people are wanting to be tested, especially as they either before Thanksgiving or after. So we did have Health Alliance increase their hours, and we thank them for that. We're asking other providers to do the same, and we're working to push every resource as much as we can. I will say that nationally, the lab capacity and the testing throughput capacity is just still not what it should be given the sheer magnitude of the national challenge of COVID. So we're doing everything we can on the ground to work within those constraints and make sure we can get as many people tested as possible. We're continuing to do our contact tracing. It's critical, even more critical, that folks participate in that. We've had a really good participation overall there. That lets us isolate any potential clusters and really try to contain the spread. We have a much more robust contact tracing capacity now than we did in the first wave. And then we'll continue to use quarantines and isolation, and ultimately, as always, continue to communicate with you all. So we're executing that. We're working very closely with our schools, administrators, staff, and teachers, as well as our businesses, to make sure that we're all doing our part to try to blunt this second wave. Other things that we're thinking about based on the lessons learned from the first wave: we know, in addition to the immediate health impacts of COVID, we also have corresponding economic impacts and social impacts that we saw play out and that could get worse again. We are very much continue to be here and ramping up our support for our business community. I encourage all of our businesses, especially our small businesses that have been struggling really most of this year, please reach out to our economic development team. We are standing by to support you as you know, the economic toll of COVID continues to bear out, especially on our small businesses. In particular, we have 2 programs that we are still have funds available in that we'll be putting out additional details on. Our Ulster Equity Loan Program that provides financing to women-owned and minority-owned businesses in the community, as well as our Ulster Responds program, which is a resource for all of our small businesses to get support and advice, business planning, and so on, and other critical resources at this time of need. So all of those are available through our Economic Development Department. If you want to also get to them, you can always go through our Recovery Service Center. But that number was up on the screen, and we'll share that on our social media as well. In addition to economic support to our business community, we're continuing to closely monitor with our Recovery Task Force all of the other sort of indicators and points of concern as our whole community is stretched and pushed, the weight on the shoulders of individuals and families in terms of being able to provide food and shelter and all the other needs we know is growing and growing. In particular, we're continuing to focus on mental health needs. We've ramped up funding throughout the pandemic to that, including in my most recent budget. We've increased our funding for opioid prevention, and we have a series of initiatives to support those that are concerned about maintaining their home, especially those that are renters. Through our tenant protection unit, we are also working to ramp up our plans for shelter options for those that are without a home, especially heading into the winter. We have our warming center open in the county, and we're also looking at other mechanisms to make sure that everyone can have food and a roof over their head and other critical needs as we weather this next wave, combined with a flu season and combined with cold weather. We know that will present a lot of challenges, and we're doing everything we can to meet that need, and along with a lot of great partners here across the county. What can we do individually to check this? We know the answer to this at this point, but I will say it's been frustrating, I think, for some and for me to see how folks responded in the first wave and how the differences to the second wave. There is just a larger number of people in our community, for whatever reasons, that are not taking this as seriously as required, are not maintaining that vigilance. And most of the health experts say that even having 20% non-compliance with mask wearing is enough to allow COVID to pick up that infection rate and get us to a place where we are. So every single person doing the right thing really does matter, given the way that the virus spreads. So please ask both, of course, yourself, but ask all your loved ones and friends and family and coworkers to remain vigilant and to get back to that mindset we were in March and April and May. Wear masks, maintain social distancing, wash hands, avoid those gatherings and social settings. Even in your home, be mindful that those you're engaging with might be asymptomatic or have not know yet that they are positive and could be transmitting COVID, and act appropriately. We're going to take some questions, but before we do that, as always, I want to thank all of our frontline workers who have been pushed to their limits and beyond this year. I know for me over Thanksgiving, and I imagine for many of you, a lot of my thoughts were with this list of people and more who have gone above and beyond for us, and we heard leaders across the country, including the president-elect, talk about how thankful and appreciative he was that we have this group of folks who are willing to put the community first and to act selflessly to protect others. Let's all use that as really an inspiration and a motivator for us to do the same. And I know that everybody tuning in here, you are sort of the vanguard of that, and I appreciate that. While we look at some questions here, I'm going to put up the number for our Recovery Service Center. That is the number to contact, or the email, the website to contact if you have any questions or needs, whether it's related to COVID, testing, any of those questions, as well as food, shelter, and other critical social needs. So I am going to pull up some of the questions we're getting here, and bear with me 1 second. We'll get to as many as we can. Okay, so we're having some questions about rapid tests and how we're counting those and how they factor into the numbers. We are really being very careful about how we report our positives, and we are reporting separately those rapid testing results. I will say the way that the rapid tests work is that if they're going to err one way, they err towards not detecting. So we feel confident, very confident, that when a rapid test comes back positive, it is definitively positive. That's one thing that all of the health experts agree on. The risk with the rapid test is actually that the threshold to detect is a little higher, so it's possible to take a rapid test, come back negative, but actually have a lower viral load and still have COVID. But if someone is positive on any of our rapid tests, we feel confident counting those results towards our positive numbers, and we are increasingly adding to our rapid testing capacity to make sure that we can meet the testing need. We're getting lots of questions about the school situation, which I know is on the minds of many, many parents. Here's just one example of that from Bobby. Shouldn't the schools go remote at least until January? This is going to get bad. So here's what's going on with the schools. First off, I had a really good call yesterday with teachers from all of our school districts, and I appreciate them taking the time. We're in regular communication with principals and nurses and administrators to have a data-driven sense of what's happening in the schools. Within the confines of the school, we're actually doing quite well, and that's because people are taking it seriously. Teachers and students and faculty, they're wearing masks, they're maintaining distance. When students are in schools, they're doing all the right things, which is frankly further proof that if everyone were doing that, we'd have much lower numbers across the county. That being said, we are starting to see the numbers even in the schools go up as we see community spread from outside the schools come in to the schools. I expect that could and probably will go up in most places post-Thanksgiving, given despite our warnings and our requests that we just can assume that folks got together more than normal. So we are closely monitoring that. At this point, we're still trying to get that balance right of where we can safely keeping in-person learning going for all the reasons that have been talked about. But we know that for more and more districts, increasingly, that is becoming untenable, and we're in daily contact with the school superintendents and leaders who will ultimately make those decisions at a district by district level. I think that makes sense that we use the data on the ground in each district to make that decision, and that's what we will continue to do. Question about testing sites. Why don't we have another testing site set up at Tech City? Asking for more drive-through testing. That's something that we are going to look at, and we're talking to our healthcare partners about. We still can do the same number of tests that we were doing with the drive-through testing, believe it or not. That particular site moved from the Tech City parking lot up to the New Vance site at the former or at the Hudson Valley Mall, and we can still do the same number of tests. However, that's something that we will be talking to our healthcare partners about, whether that makes sense to ramp that up. So, Nicole, thank you for that question, and we're going to continue to do everything we can with the constraints on testing. Here is another question from Jasmine. Will we be going back to reduced workforce and essential only with the way that the increase is going? Really good question. So I can tell you what we've done with our county workforce, which is one of the largest employers in the county. Actually, starting last week before the Thanksgiving holiday, to try to be proactive, I directed that only essential county staff be in the workplace in order to try to help do our part to lead by example, to blunt the effects. And I've asked all businesses and organizations to the degree possible to do that, to protect our workers and to protect the whole community. In terms of what the state is doing and the different sort of zones, we have the yellow, the orange, and the red zones. We are not yet in any of those zones, but as we hit those metrics, there are some restrictions on gatherings and on businesses, and that will impact in some cases who shows up and who doesn't. Essential workers will still need to, are essential for obvious reasons and will need to show up. But we are trying to get, again, that balance right. We don't want to broad brush shut down our entire economy again, because we know that the second and third order socioeconomic effects of that are really dangerous as well, especially as we're now many months into this. So we will continue to look at that, but at the informal level right now, and I've seen many businesses doing this, and we've been working with many to do this. Whatever you all can do now to that end really will make a difference. Another question on that front, we'll take 2 or 3 more from Melinda. Are we in a yellow zone yet? The short answer is no, we are not in a yellow zone yet. In order to be, excuse me, in a yellow zone, we have to be 10 consecutive days of over 3% positivity rate, and that 3% positivity rate is a 7-day average. So that's very complicated, but basically we're not there yet, but we are very much headed that direction. The other thing that is new in terms of the zone designations is yesterday the governor added, as I mentioned, additional criteria around hospital capacity and staffing and so on. We don't yet know and don't yet have definitive guidance from the state about how that will factor into these. So as soon as we know that, I imagine by Thursday I'll have more detail on that to share. But that is rapidly changing as the state looks at those requirements. What I would say is, although we're not officially in that zone right now, as I said at the very top, I am ringing the alarm bell and asking everybody to act with whatever means they have to put in place and follow those precautions as if we were in these zones, because that is where we're definitely headed if we don't change things in a pretty fundamental way here. I think those were some of the main. I know we didn't get to all of them, but I know, so we talked about the situation at schools, we talked about testing and testing capacity. The only other thing that I want to hit on briefly is vaccines. I'll be talking more about this likely on Thursday. This is the point for some optimism that we now do have a near definitive and certain light at the end of the tunnel next year in terms of multiple vaccine trials going well, and knowing that one of the next logistical operations for us coming into 2021 will be wide-scale distribution of COVID vaccines. With that in mind, we've been planning and are really increasing the frequency of our planning efforts and our coordination efforts around vaccines. But I want to be very clear on this. We are still several months away from being anywhere near widespread distribution of COVID vaccines. We know that the first wave or waves of the vaccines will go to healthcare workers, some other set of critical essential workers and health workers, possibly to vulnerable populations, including seniors, but that it will be, again, many months before we are to that point of widespread vaccination. The FDA hasn't even approved any of these vaccines yet, so I don't want, while it is reason for long-term optimism, I don't want us to rest on the fact that that the vaccine will get us through this wave, because it won't, unfortunately. I think our best hope is that we blunt this second wave and buy enough time to get us to the vaccine in the spring, and really try to just hunker down as we get through this tough period and approach that end of the tunnel. So those were some. I know not all the questions. We'll continue to take those questions. I appreciate it. It helps us know what's on your mind. It helps us tailor our approach. And I thank you all for tuning in. I thank you in advance for helping to spread the message of the seriousness of where we're at. And I will end by saying the good news is that we have been through this, both individually and collectively. We've seen really dark and difficult times, a point in April where we had 1 ventilator left for the whole county. But we've also seen the whole community rally and act collectively to follow precautions, to get food to each other, to take care of each other, to donate time and volunteer hours, to man a call center or check on a neighbor or deliver a meal. So we know we have it in us to act collectively, and it is not too late. In fact, it's necessary to do that again. So I appreciate everybody doing that. We will continue to keep you updated with the data and the facts, and also our whole team here at the county and across the county, both town and city leaders, healthcare leaders, so many others. I want to thank you for what you're doing. I know everybody's doing everything they can, and we will not rest. We will not let down until we get these numbers back under control. So we'll see you again for our next update on Thursday at 2 p.m. I want to thank the Radio Kingston team. I want to thank Diana Manuel for helping us bring this message to you. And until then, please be safe and healthy, and we will continue to stay resilient through this. And we'll see you in 48 hours.